Eating disorders are a group of disorders which all have one thing in common. At the heart of it, there is disordered, abnormal eating behavior. This can go from persistent undereating, as in anorexia nervosa, to persistent overeating and episodes of out-of-control eating, which can be very, very distressing for people. My name is Ulrike Schmidt. I'm Professor of Eating Disorders at King's College London, and I also work as a consultant psychiatrist at the Maudsley Hospital in the Eating Disorders Unit. And I will talk today a bit about what are eating disorders and how we can treat them. We need to think about what drives these behaviors, and that is often that people feel very distressed about their weight, shape and appearance and are very unhappy with it and want to somehow try to correct this. Often the disturbed eating behaviors go along with other compensatory behaviors that are designed to help the person regulate their weight. And these are often very unhelpful. This can include excessive exercise to the point where the person never gives themselves a break and may run into injuries. This can involve self-induced vomiting or use of medicines to control your weight. All of these can have dangerous side effects. Eating disorders also have potentially major impacts on people's physical and general mental health. So if you're persistently undereating, over time you may notice that your skin becomes dry and flaky, your hair starts thinning, because it's very stressful to undereat persistently. You may also find that you feel faint or dizzy. You may find that you can't concentrate, that you're permanently tired, that you're feeling the cold. Over time, your periods may stop. And it really affects your whole life. Some of the additional weight control measures that people are using, such as vomiting or medicines, have a big impact on our blood salts. And this can affect the way your heart works, can lead to arrhythmias. This can be very dangerous, and in extreme cases can lead to the heart stopping and the person dying. It can also lead to impacts on the brain and cause epileptic fits. Now again, this is rare, but it is a real potential side effect. So these disorders have really potentially dramatic major physical complications and consequences. But they also affect people's general well-being. It may make people anxious and miserable. Some people become more obsessional and find themselves engaging in all sorts of routines and rules that they can't shake off. And people become more isolated and don't want to have relationships and don't want to go out with their friends or family anymore. So impacts on mind and body are really serious. In terms of diagnoses, we have three major eating disorders. There is anorexia nervosa, where people are very underweight and are in a permanently starved state. Most people are familiar with anorexia nervosa. There's also bulimia nervosa, where usually what happens is people get locked in a vicious cycle of undereating and then having episodes of binge eating, where their eating gets out of control, and then they try to correct this by engaging in vomiting or in using medicines to counteract the binging, but all of this just keeps them locked in a vicious cycle. And the third eating disorder is binge eating disorder, where people have very distressing, prolonged episodes of overeating that ultimately lead to overweight or obesity and all the complications that go with that, such as hypertension or type 2 diabetes. So those are the major eating disorders that we know, but many people have a mixture of symptoms and don't fit neatly into these categories. And what's important is even the people who have a mixture have a clinical eating disorder that needs help. There are a lot of resources out there from trusted sources if you want to learn more. If you want to learn more about services and what you can do to help yourself, I would recommend the BEAT website. If you want to learn more about research and the latest developments in eating disorder treatments, look at our websites on the King's website, check out the Center for Research in Eating and Weight Disorders, where you can find out about our ongoing studies, and also check out our website specifically for young people and on early intervention, which is called edifyresearch.co.uk.